Hi, good afternoon, everybody. My name is Glenn Barnes, as you can see. I'm a doctor of osteopathic medicine, and I am certified in sports medicine, so that's the fellowship I did after my family medicine residency. And I just want to thank everybody for coming out today to listen to me jabber at you about something that's pretty important and often oversimplified in terms of maintaining our health, which is building of strength and making sure that your core stays stable. These two things, the building of strength in the lower extremities and the stability of your core, are the two largest predictors of your ability to function as we age. So this is why I opted for this topic today. Before we get into it, an obligatory legal disclaimer. This presentation is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed, and the use of the information and materials in this presentation is at your own risk. The contents of the presentation is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions. Now that's over, let's go. All right, so it's nice to meet you all. Like I said, my name is Glenn Barnes. I was born in San Jose, California. I was raised in Lake Havasu City, Arizona. I moved here in my sophomore year of high school at Silverado High School, which is over in Henderson, off like Eastern and the 215. From there, I went to UNLV. I did my undergraduate in pre-professional biology, which is a fancy way of saying pre-med. Then I went to Touro University out in Henderson once again, where I got my Doctor of Osteopathic degree. From there, I went to Valley Hospital Medical Center, where I did my family medicine residency. I served 3 years there, and in my final year, I served as chief resident. Then from there, I went to, yes, question? Sorry. I told some of the people here, I tend to just go, and I apologize. I'll slow down. And this stuff is so rote, in my memory. So after my family medicine residency at Valley Hospital downtown next to UMC, then I went to UNLV, and at UNLV I did 1 year of sports medicine fellowship. So that's 1 year specific training, nothing but the musculoskeletal system and everything related to engaging in sports and activity. From there, then I was hired on with UNLV as core faculty within their sports medicine fellowship program, as well as in the Department of Family Medicine and Community Medicine, where I'm an associate professor. I currently see patients on an outpatient setting, right? So I'm not a surgeon. I don't do anything in the operating rooms yet, to be determined. Something's on the horizon. In addition to my employment with UNLV, I serve several roles within the community. So I am head team physician for Las Vegas Aviators. That's why I wore the shirt today. So that's been very exciting. I am also the head team physician for the Henderson Silver Knights, and we'd had a very good season this year. I am just a regular team physician for the Las Vegas Aces, who are currently doing very well in the WNBA. And then I'm also a team physician for all the Division I athletes at UNLV. So that's who I am. Why did you stop working? Listen, it worked great. No. Go. Okay, that's weird. All right, so what are we doing today? So I really want to explain to you guys why you should care about what I'm saying to you. The worst thing when I would go through my years in lecture halls is no one would ever tell me why I should care. And so that's the first step, is why should you care about what I'm going to tell you? All right, then after you understand why you should care, then you need to understand the principles of strength training in order to incorporate those in your day-to-day activities and in your exercise program. Then we'll do a brief anatomy of the review of the lower extremities. So that's going to teach you what muscles I'm talking about when I say hamstrings, when I say calves, gastroc, soleus. When I use these terms, since we'll do the review of the anatomy, you'll be able to incorporate that information. Then we're going to provide just a brief example of what a lower extremity training plan should look like that's targeted at just general health and strength. So we're not targeting specific sports like tennis or golf or anything. This is just a very general training plan that can be used for everybody in order to maintain lower extremity strength. Then we'll move on to the core. So then we'll do the same thing, brief anatomy review of the core and what that really means. Then we'll once again provide sample exercises and sample training plan of how you can train your core. And then we'll try to save time at the end for questions, okay? My goal is hopefully not to have you guys experience death by PowerPoint. So I really want this to be interactive. If there's any questions at any point in time, please feel free to raise your hand, tell me to slow down, tell me to explain that. Don't use those big words because, you know, while this is very second nature to me, this is what I do day in and day out. It's been what I've been doing for a decade. I understand that not everybody has that same familiarity. So it's hard sometimes for me to tamper my enthusiasm. So please help me. If you guys have a question, raise your hand, interrupt me, shout out. It doesn't matter. You're not going to offend me. All right. See, I did it again. It's like it goes dead if I don't. I'm just keep touching. So, all right. So what's the value in strength training? All right. So the American College of Sports Medicine recommends moderate intensity strength training at least 2 days per week. Okay. And specifically the introduction of strength training into your exercise regimen has been indicated in what we call primary prevention of these diseases. Okay. And I bolded primary because what does that mean? Primary prevention in the medical terminology means preventing a problem before it ever occurs. So if we just use the very common symptom of a heart attack, right? People say take aspirin for the primary prevention of heart attack. You take an aspirin, it lowers your risk of ever having a heart attack versus let's say you do have a heart attack and then you take aspirin, that's secondary prevention, right? So that's preventing the recurrence of an injury. So if you look at this list comprises well over 90% of the mortality and morbidity associated with aging. I put an asterisk next to cancer because strength training does not aid in primary prevention of all cancers. I have a list here, that's why I wrote it down. So it's colon, breast, prostate, and lung cancer. Specifically, strength training of older adults has shown to reduce the incidence of those types of cancer. So when you put those 4 major causes of cancer along with the rest of this list, you can really make a significant impact in the chances that you will suffer one of these problems. Nope. It's slow. It's just slow. I just need to be more patient. So dyslipidemia, so there's those big words again. So this is high cholesterol, right? So this is your lipids, right, or your lipid panel. So dyslipidemia means bad. Lipid is lipids and emia is blood. So bad lipids in your blood is what dyslipidemia means. So it's high cholesterol depositing in the artery walls, causing plaque, which leads to stroke and vascular disease and heart attacks and things like that. And then cerebrovascular disease, that means stroke. Type 2 diabetes is the type that as we age we get. It's not the one that's insulin dependent from birth. Brittle bones, depression, anxiety. And then hypertension, by the way, hypertension is high blood pressure. My mom taught me that not everybody knows what that one means. This is really annoying. Am I too far away? Maybe I'm too far away. Okay. So let's dig more into the American College of Sports Medicine recommendations. So it's at least twice a week and it's on non-consecutive days, and that's very important. You should not train Tuesday and Wednesday strength training. It should be maybe Tuesday, Thursday, or Tuesday, Friday, right? Put some time in between there. The strength training purposefully damages your muscles in a healthy way. As you resist a force, there's micro tears that occur in the muscle fibers, and when your body repairs those over the subsequent days, your body, what we call supercompensates or overcompensates. So it builds back stronger than it was initially. So by training on consecutive days, you're not allowing the body to respond to in the compensation in order to build back stronger, and you just continue to tear it down, which will lead to injury and overuse. So that's why it's very important that it's non-consecutive days. They recommend 8 to 10 exercises per training day, focusing on the largest of the muscle groups. And as you can imagine, our legs and our core are really where the large muscle groups are located, right? The deltoids, the biceps, the triceps, those are, important muscle groups, don't get me wrong, but if we're really targeting large muscle groups, the core and the lower extremities where the biggest muscles are located in our body. The resistance should be adjusted to allow for 10 to 15 repetitions before fatigue and form decay. So that means if you're doing a squat, okay, you should be at a rep range where you're in between 12 and 15. As you come up on your last one, you should be fighting to maintain your form. If you're doing a squat and you have to like bend forward and you drag up like that, you've lost the form, okay, and therefore you've already hit muscle failure and you've gone too far. So you need to adjust the weight to where that occurs within 10 to 15 repetitions. All too often I see people with like 1, 2, or 3 pound weights, and they're doing maybe a shoulder press, you know, or they're doing squats, and they do 20, 30, 40 repetitions. Unfortunately, that's not building strength, it's building endurance and can be used in off-cycle training. But in terms of our presentation today for building strength, you really need to be challenged in the 10 to 15 repetition range. And then the level of effort should be moderate to high. And what that means is if it's on a 10-point scale, anywhere between a 5 and an 8 out of 10 effort. Okay, so if you're pushing absolutely as hard as you can and you're not moving in the weight, that's a 10 out of 10 effort, right? But if you're pushing as hard as you can and you can still get out 1 or 2 more reps, that's like an 8 out of 10 effort. So adjust the effort, adjust the weight in order to get your rep ranges at the intensity that's listed here. Yes.
So when you say train twice a week.
Correct.
So that means train anything, or if you do arms, wait 3 days. If you do legs, you could do it a consecutive day, but then 3 days later.
That's correct. So you don't want to train the same muscle groups on consecutive days, right? So let's say if you want, remember this is minimum, probably more realistic is 3 days of resistance training a week. So you'll do, let's say, lower extremities and core, and then you'll do a day of cardio, then you'll do your upper extremities, and then the day after you can do lower extremities and core again. So as long as you don't do the same muscle on consecutive days is the principle. Okay? So secondary benefits of strength training. So these are other things that may not necessarily lead to a direct reduction in some sort of disease process, but are very true in terms of the things that exercise causes. And this is a nice picture of how to do a proper squat, which we'll go into later. So let's talk about the principles of strength training. Everybody has probably at some point in their life hit a plateau, right? So you're doing some sort of exercise, you see some initial improvement, you start to get better, but then all of a sudden, things just stop changing. You can't lift any more weight, you can't do more repetitions, you get fatigued at the same amount of time, you're just not getting better, right? And why? If this principle of compensation after exercise holds true and doesn't vary, you should always and forever get better. But our bodies are very, very smart and they're very adaptable. So when you do the same thing over and over, your body knows and specifically gets good at that single thing, and you will stop progressing. So that's where the concept of periodization comes in. And what you can think of periodization is periods of various training, right? And so you change the training in any way you see fit, okay? So you can, instead of doing 10 to 15 reps, you can do 5 sets of 5. Instead of doing 90-second rest, you can do 30-second rest. You know, instead of doing a forward lunge, you can do a reverse lunge. As long as you change the training in some form, whether it be the type of exercise that targets the muscle group, whether it be the volume, the frequency, the type of muscle contraction, the weight, the repetitions, the sets, you need to change it. But if you simply do your 4 sets of 10 of your bicep curls or your squats, and that's all you do for weeks and weeks on end, you will plateau and you won't improve. And so that's what you see here, is that you implement training, you get better, but then you plateau. And at this point, this inflection point, that's where you make a change in your training plan, and once again, your body adapts and gets better. You can only do this so many times, typically 4 to 5 cycles, before you need a prolonged recovery period. And the reason is you can't just do this forever, because you will overtrain. So typically, it's about 4 to 5 cycles, okay, or 4 to 5 periodizations before you need a planned rest and recovery in order to prevent overtraining. And that's what that says, that's what I already said, and that's what I already said. Okay, so how do we define a resistance or a weight, right? Because it's really easy to say, hey, just, give it moderate to high intensity and just, go for 10 to 15 reps. So it's pretty easy math to do. So we describe intensity based on the percentage of what your 1 rep maximum is. So let's just take a squat. For example, let's say my squat is 200 pounds, right? And I can do 1 squat with 200 pounds on my back, and that is the most I can do for 1 single rep. First of all, that's dangerous to do. So before I go any further, I don't recommend anybody in here to do a 1 rep max unless you are specifically working towards that, like, you're going for like the senior games or something like that, then okay, maybe. And it should be done very strictly, very controlled with a trainer. Be careful. So instead of putting yourself through that risk, we can calculate it. Okay, so if you just Google 1 rep max calculator, this one pops up. And what you can do is you can put in the reps that you do, okay, to meet that the 10 to 15 reps before you reach your, quote, moderate to high intensity failure, and it will spit out a number. So for example, let's say you're doing squats and you could put 40 pounds on your back and you can do 14 or 15 reps. You can punch that into the calculator and it'll say, okay, well your 1 rep max is probably 95 pounds. And then you can use that to program in 60 to 80% of your 1 rep maximum and use that number, whatever 60 to 80% of your 1 rep, to do your 10 or 15 reps, right? And to do your sets. So there is a way to go about calculating this stuff and really put some objective numbers to make sure you're hitting the goals, you're hitting the numbers, and to ensure that you're gonna get results from your exercise program. And this is tried and true science. If you take the time to count your repetitions, mark the exertion level, and then punch in the numbers and start to build your training plan as you go forward, you will see great results. Okay, so the choice and the order of exercises. All right, so the choice of exercise is relatively irrelevant, okay? What it simply needs to do is activate the muscle you're after, okay? So I would not recommend a calf raise, okay, if you're training your quads, right? So all you gotta do is choose an exercise that exercises the muscle you're after that's comfortable for you. Some people might not be able to do squats, right? And instead they'll do the leg press machine. Or if they can't do the leg press machine, they'll do the leg extension machine, all right? So just choose whatever works for you. Doesn't really matter what it is, okay? But what matters is the frequency and the intensity that we've already talked about. So choose whatever is appropriate for you. And then the order of the exercises, you should always exercise what we call compound movements first, okay? So compound means more than one. So if you're sitting on a leg extension machine and you straighten your leg, the only thing that you're working is a quadricep, right? There's no glutes because you're sitting down, right? There's no IT band because once again, you're sitting down, there's no lateral movement. You're gonna wanna save those for after you've done your lunges, right? Because a lunge will work your calf, it'll work your core, it'll work your hamstrings and glutes, but the main thing it targets is your quadricep. So you do your larger movements first. The reason behind that is because at the beginning of an exercise, you're the least fatigued. You have the most energy. There's lots of sugar in your muscles ready to do the exercise that you're gonna do. Oh, I think we lost power. Let me see. Yeah, it's dead. It's dead. All right, so I'll just talk really loudly. Everyone good? All right. All right, let's get this off. Give me one moment.
Do you want batteries? Jesse has batteries.
All right, so, and then we'll let them decide whether or not you want me to put that thing back on. Okay, so, and the reason is you have lots of energy in the muscles, right? Everyone knows as you get towards the end of a workout, you start to get fatigued, right? And things start to become harder. You don't want to be doing these compound exercises when you're fatigued, right? Because the compound exercises require more mental focus, more stability, and things like that. So start with your larger exercises first, and then work into the specific individual single limb exercises or single muscle exercises. So that's what that says. That's self-explanatory, and then that's what I said already. All right. Let's see. So, and then how about rest periods, right? So I've done the exercise. Now do I just sit around and twiddle my thumbs? Well, some people say yes. Other people say you should maybe do some light cardio, like maybe some butt kicks or some gentle running in place or something like that, just to keep the heart rate going. But something really light. Don't do something really intense in between lifting exercises. So you shouldn't be doing burpees, right, where you get down, you do a push-up, then you jump up and you jump down. Like, you shouldn't be doing that. Just light running, right, or some marching in place, right, some arm circles, some dynamic stuff. Now, the lighter the weight, the shorter the rest period, right? Your muscles don't need as much time to recover if you didn't tax them a lot, right? So that makes pretty good sense. Anything less than 60 seconds is considered a short rest period. So if you don't feel like you hit your moderate to high intensity, right? If you got to 15 reps and it was pretty easy and you didn't really struggle and you kept your form real tight, you should probably keep your exercise rest periods less than 60 seconds. As you start to get up in the intensity, you should really stretch that out to over 2 minutes, right? So if you really fought for that last rep and that last rep was your 10th rep, you should rest for at least 2 minutes, right? And that 2 minutes allows the muscle cells to rebuild the energy to allow you to safely perform the next exercise. So rest periods are important. For the first 6 to 8 weeks, do not go less than 90 seconds. If you're relatively sedentary and you're new to an exercise and strength training program, you should always rest for at least 90 seconds for the first 6 to 8 weeks. The reason being is because there's actually central nervous system fatigue. The brain connecting to your muscles is learning to get better. And that takes time to develop and it takes time to recover. But after 6 to 8 weeks, it can then recover within the 60-second period and you can start to do faster, more controlled, safe exercises. So if you're new to activities, 6 to 8 weeks, make sure you're doing at least 90 seconds of rest between strength training exercises. All right. Warm-up exercises. So if you guys are like me, when we were in grade school, we always did you sit there and before you do anything, you stretch out your quads, right? You stretch out your hamstrings, you stretch out your calves, and you just do this kind of thing, right? And then you go do your exercise. That is a thing of the past. That is not the way it should be done anymore. So please don't do that. You are setting yourself up for injury and actually reduced athletic performance. So I recommend a dynamic exercise. So what's a dynamic exercise? That's one where you're moving, right? So yeah, you can do like Jesse's doing in the back, right? You can do side to side. You can do arm circles, right? You can do these kind of things. You can do little side steps like this, right? Something that uses the muscles you're after in a very light way that doesn't challenge the strength, but gets the muscles moving. It gets the brain connecting to the muscles. It gets the fluid within the joint to start lubricating the joint so that you can perform these exercises safely. It should last for anywhere from 3 to 5 minutes. And then after you do the exercise, the single largest piece that people miss from their exercise routine is the cool down. Nobody does cool downs, and I cannot stress to you enough. Please do your cool downs. Cut 5 minutes off of the exercise and spend the 5 minutes doing the cool downs. Please, please, please. Think about it this way. You just spent all that time, all that hard work, all that energy investing in your health and in your function and your strength. All right? But what did you do during that time? You caused a little bit of damage in all your muscles. You stressed your tendons. You put stress on your joints. As you should, a healthy stress, a physiological stress. But if you don't stretch out those muscles afterwards, everyone here has felt tight, right? If you don't cool down, you feel really tight. It's hard to move around after an exercise, and particularly the day after. So if you stretch out, doing the stretches we all learned in grade school, after the exercise, it will preserve your range of motion, okay? It will reduce injury in the future. So these ones, right, where you sit there and hold it for 20, 30 seconds, those are the ones you do after the exercises. Sure. So remember, so the beginning one, the warm-up is the dynamic, right? So it's this light movement, it's getting everything flowing, getting everything going. The cool down should be static, right? So that's where whatever muscle you trained, you want to hold it on a stretch for 20 to 30 seconds. So let's say we did hamstrings, right? So you just reach down towards your toes and you'll feel your hamstrings pull, right? Get down till you start to feel them stretch, and you just sit there for 20 seconds, 30 seconds. If you trained calves, right, you put your foot back and you stretch out your calf, and you just, once again, hold that for 20 or 30 seconds while you feel the stretch in the muscle that you just trained. And that principle applies to every muscle. If you did chest, right, you know, you can clasp your hands behind your back, reach down, and then look up, right, and that stretches the chest, right? So whatever muscle that you trained, you want to hold it on a static stretch for 20 to 30 seconds after your exercise is all done. Did that answer the question? Okay. So it's more, I like to teach principles. I really enjoy principles because you might forget the specific thing that I taught you, but if you remember the principle, you can apply it and you can figure it out. Here's just some examples of what a dynamic stretch looks like, a dynamic warm-up routine, and then, oh, this answers your question very nicely. Here's all your static stretches, right? So holding the leg, you know, put your arm on a wall, lean into it for your chest, shoulders, triceps, glutes, right? So this is a very good static stretching basic program right here. All right, so let's get into the actual lower extremity, right? So they're called quadriceps because there's 4 muscles, right? Quad means 4. So there's 3 vastus muscles and there's 1 rectus muscle. So if you look here, the vastus lateralis is the quadriceps on the lateral side or the outside of the leg. The vastus, So then you have rectus, right, which actually comes from the hip, crosses over the joint, and then goes down to the knee. And this is important. We'll talk about this in a second. Underneath that, if you take this away, this is what you have left is your vastus intermedius, right? And then on the inside of the knee, you have your vastus medialis. Of these 4 quadricep muscles, the one that tends to cause everybody the most problem is the rectus, okay? The rectus femoris is a quadricep muscle that actually comes from your pelvis, crosses over your hip, and goes down to your knee. Anytime you have a muscle that crosses over 2 joints, right? So it crosses over the hip and it goes to the knee, so that's 2 joints. This is the most common muscle that you're going to develop problems in. So making sure that you pay extra close attention to make sure that you're keeping a flexible hip and a flexible knee when training quadriceps is important. So that's the most common one to be injured. The next most problematic muscle is the vastus medialis. So if everybody here in your chairs, you're sitting there, if you straighten your leg, but not 100%, so just from 100%, maybe bend 5 degrees, 10 degrees. Everybody put your hand on the inside of your kneecap and the quadricep right there, and then finish the knee extension. Everyone feel that muscle on the inside turn on? It only happens in the last like 10 degrees. That's the only time that quadricep muscle, the vastus medialis, fires. So when you're doing your lower extremity exercises, it's very important that you finish the full range of motion in order to make sure you train the inner quadricep or the vastus medialis. Why is this important? Why am I going down this rabbit hole? If you look at the direction, all these quadriceps are pulling on the kneecap, right? All these muscles are coming down and they're inserting onto the kneecap. The only one that holds the kneecap this way is the vastus medialis, is that inside, right? Without this muscle, the kneecap will drift outwards. Does that make sense to everybody? Question? The front, yes. Yeah, the muscle in the back that's often confused with that is called the biceps femoris. So rectus femoris in the front, biceps femoris in the back, which we'll go through on the next slide. And it's also the most superficial quadricep muscle, which means the most closest to the skin. So that's why people, when they look at someone's quadriceps, they often see the rectus But in terms of injury, the most common injury is the rectus. In terms of underuse and developing knee problems, it's actually the vastus medialis, because so many people, when they're doing their leg extensions, they don't really squeeze out that last 3 or 4 degrees of the knee extension, but it's very crucial. So whenever you're doing your lower extremity programs, please make sure you're getting to full knee extension to fire that inner quadricep, to make sure that patella or the kneecap is riding where it should in the knee. Question?
What are some of the reasons that you get Charlie horses?
So there's considerable debate in the medical literature about why people get Charlie horses or muscle cramps, right? One of the main causes is thought to be a calcium regulation issue within the muscles. So a muscle contracts because of a flux of calcium. So people say, should I take more calcium? Well, not really. It doesn't do anything at the muscle. Then the next is, okay, is it dehydration? Is it potassium imbalance? Well, people have taken potassium. It doesn't really do anything. It's probably more of a conditioning problem and a neuromuscular control problem. So the only way I've ever had success in treating people who get Charlie horses or muscle cramping with exercise is a very slow and deliberate increase in intensity of exercise combined with the flexibility program. Often, when you're trying to fight for some range of motion in an exercise that your muscle is not used to, it can go into spasms. So it's establishing a healthy range of motion followed by a very slow increase in intensity, the periodization, to build the endurance of the muscle so it doesn't fatigue and spasm. So I don't think you're going to find anyone who gives you just a rock solid answer on that. But in my clinical experience, it's range of motion and slowly building in endurance in whatever muscle is causing the issue. So unfortunately, there's no quick fix for that one. That's a tough one. Yes. Yeah, so whatever muscle is spasming, you want to hold that muscle on a stretch. It hurts, but it's the fastest way to get it to go away. If you don't, right, like for instance, I used to get them in my calves a lot when I started running. I would sit down on a bench and I'd just hang my leg like this, and because that's the way that it would hurt less. But I'd sit there for 10, 15 minutes while it was cramping. And when I just kind of bit the bullet and just stretched that thing out, it only lasted a couple minutes, 2 or 3 minutes, right? So yes, it's painful to do that, but you'll get out of the cramp faster. So if you're not in a hurry, right, just sit there and just baby it, right? But, if you're pressed for time, I recommend stretching it out. And by the way, for me personally, when I started stretching after my workouts, my cramps went away. Right, the cool down. You've got to do the cool down. All right, so that's my point is rectus femoris is the most common injured one. Vastus medialis is the most commonly undertrained one and can lead to problems in the knee. All right, so let's go over hamstrings. So hamstrings are the muscles that come from that bone that you sit on. So I have one right in your butt, that sit bone I call it. It comes from the sit bone and goes down to the back of the knee. There's 4 different muscles. There's the semitendinosus, the semimembranosus, the biceps femoris, which actually has 2 muscles, and then there's one that's not shown here. I won't go into it. It's a little bit, the point's mute, so I'm not going to go into it here. But there is the 4th one that's not here. Trust me, but it's not important. So the biceps femoris is the only hamstring that goes to the outer leg. So if you ever feel a hamstring issue and it's coming down and goes to the outside or the lateral knee, you know that that's going to be your biceps femoris. If it's going down the middle and then starts to drift to the inside of the knee, you know that that's either your semitendinosus or your semimembranosus. Of all 3 of these, your biceps is the most commonly injured. All right, just playing the odds. So these muscles, right, coming from the pelvis, your sit bone, inserting into the back of the knee, they're what lets you flex the knee, like so. Okay, so every time you sit down and you pull your leg in, the hamstring curl, you're working these muscles. Question? So absolutely, hamstring issues commonly irritate the sciatic nerve, and often sciatica is misdiagnosed as hamstring pain and vice versa. Reason being, if I were to draw the sciatic nerve for you, it comes like this. It comes down and goes right next to it, and comes down and goes right next to it. Like it literally lives right next to it. It touches the hamstrings. So often people who have hamstring injuries develop sciatica. People who have sciatica develop pain in their hamstrings, and they cross-talk to each other quite a bit. So some significant diagnostic work and trials of different injections can help tell that apart. But you're very right. Sciatica and hamstrings are very closely related. Okay, then the adductors, right? So there's adductors, ADD, and abductors, ABD. So adductors, ADD, add the leg back to the midline, right? So these are the ones on the inside of the leg that let you squeeze your legs together, okay? And they're named very simple. They got an adductor magnus, brevis, longus. These ones are very commonly the source of groin pain. So if you close your legs and you're feeling like a deep pelvic pain right here, it's very common to get some tendinopathy or some micro tearing of the ligaments here at the insertions. There's not too many problems with them distally. It's usually just at the pelvis. And then abductors, okay, these are what abducts, like an alien abducts somebody and takes them away. It abducts the leg, right? So it takes the leg away from the midline. And these are your glutes, right? So your gluteus medius, your glutamus minimus, and then something called the tensor fascia lata, which goes down the outside and goes down to the outside of the knee. So those are the 4 compartments of the thigh. All right, and I will do my best to, yes, question? Yes. 100%. Yes, absolutely. Where's that? I can keep going. Yeah, so a torn glute, right? Number one, it needs to be graded, right? So how much of a tear is there? If you've got like a 95% tear, that's pretty much a surgical case, right? But if you've got at least 30% of the fibers left, there's quite a number of conservative things you can do to help regenerate the tendon to grow back and to be healthy. But large tears, over 70% of the fibers, if they're torn, you're probably looking at surgical therapy to repair the tendon. Right, so you got to grade it. If it's just a little tear, probably just exercise will fix it on its own. But proper exercise and guided, if it's somewhere between 20 and 70% torn, you're probably going to need an injection as well as directed rehab and a certain period of rest. If it's more than 70%, you're probably best just seeing an orthopedic surgeon getting it fixed. So the glutes are very, very important. So as important as the quads and the hamstrings are, really I think the most undertrained muscle of the lower extremity are the glutes. Okay, so we'll be specifically talking about how to train them. And then specifically, notice I say leg here. Everything I've talked about is thigh. All right, the medical terminology for the leg is this part. Okay, this is the thigh. So if you hear me say leg, I'm talking here, not here. This is thigh. Okay, so the main things that we want to train in the leg are the gastrocnemius and the soleus. These are the 2 large muscles that contribute your calf muscle. So every time you do a calf raise, right, you see you're using these muscles. So if you look here, the gastrocnemius, okay, has 2 heads. And then they come down, and when you look at someone's calves, the 2 teardrops that you see are the 2 heads of these calves. When you take those away and you look deep to it, you have one round body of muscle called the soleus. Both of them merge together into the Achilles tendon, that really thick cord on the back of your ankle, and insert into your heel bone, and that's what allows you to push your foot down, okay, is your calves. So when you think about this anatomy, this will inform you about which position each muscle prefers, okay? Because the gastrocnemius crosses over the knee and inserts into the femur in the back, when you bend your knees and you do a calf raise, you're actually not using your gastrocs at all. You're using all soleus. But if you straighten your knees, okay, now the gastrocs can work. And when you do a calf raise, you train the gastrocs. So bent knee is good for training soleus. Straight knee is good for training gastroc. All right. let's talk about an example of a lower extremity training plan. So remember, if you think about the American College of Sports Medicine recommendations, they say 8 to 10 exercises of large muscle groups, and that should be repeated on 2 non-consecutive days every single week, right? So in my opinion, at least 5 of those 8 to 10 exercises should be lower extremity. And why? Because that's what allows us to get up, walk around, function, go to the store. That's what's going to save you from a fall. That's what allows you to maneuver quickly to get out of danger. So lower extremity is really where the biggest bang for your buck goes for function. Question?
When you were talking earlier about the number of seconds between the rest,
Yes.
is that between sets or between exercises?
Between sets. Yes, and exercises, right? So I don't recommend, if you're on your 4th set and you're on your 4th set of squats, that you rest, 15 seconds and me start doing lunges. You should rest at least for the times I listed, because we already went over that, between set and between exercises. Once you get a bit more advanced, you can start to play with the rest, but remember that takes 6 to 8 weeks to develop a good brain-muscle connection, to make sure that you stay safe. I should have made this point earlier, I apologize. Number 1 rule of exercise, number 1 rule, is don't get hurt. It's the number 1 rule. So it's all about safety, right? What are you doing if you exercise and you hurt yourself? What's the point, right? We're in here to be healthy or not injure ourselves. So we have to temper our enthusiasm sometimes and make sure we're playing by the rules in order to not get hurt. All right, so this is an example. So squats, lunges, glute bridges, calf raises, an abductor, an adductor, supersets, and I'll go into what a superset is here in a minute. You want me to do a glute bridge? Sure. So glute bridge, like this. So like this, feet flat on the floor, right? And you pick up like that, right? And the point is to squeeze from the butt. You should be pushing through your heels, right? So you can even pick your toes up off the ground and squeeze the butt, right? You don't want to arch the chest. You want to push the pelvis, okay? Thank you. Yes.
When you were helping me, and we did glute bridges before you worked with me, you told me that the glute bridge resets the hip.
Yes, so Mary makes a great point. So I'm a DO, right, which is a doctor of osteopathic medicine, which means I perform something called OMT, or osteopathic manipulative therapy. When I'm evaluating someone, especially for pelvis or proximal thigh, low back issues, I always want to make sure that their pelvis is in their natural position. And a way to do that is to do a glute bridge. So if you're being looked at by a provider for maybe low back alignment or hip pain or knee pain or whatever they're looking at, and you're laying down on the table, I recommend put your feet flat, pick your pelvis up, put your pelvis down, and then straighten your legs back again, because that's going to reset and put you into your normal anatomic posture that your body likes, and that way you can get a good evaluation. So glute bridges are good for evaluation, but they're a good exercise too. So let's talk about squat. So it's very important to understand a proper squat. It's probably the single most incorrectly performed exercise there is, and this one kind of highlights a lot of improper form that if you just avoid these couple things, you'll end up doing it right. I also want to point out that while it's not listed, look at the depth this lady is squatting and look at the depth this lady is squatting, right? Much, much deeper. As we get deeper in a squat, the form gets harder and harder to hold. I really don't recommend squatting past parallel. So you can see her thighs are parallel to the ground, so that's what we call parallel. The benefit of squats occurs between here and here. Deeper than this, you get into trouble. More shallow than this, you're not getting any benefit. So the benefit occurs between, this is what we call 90, because you can see her thigh and her leg are at 90 degrees to one another, and parallel, while her thighs are parallel to the ground. So the benefit of a squat is between these two ranges of motion, okay? As you go from this range of motion deeper into the squat, these are the things that we're avoiding, okay? So we want to keep the chest up, we want to keep the chin up, chest up, pelvis back, your pressure should be on your heels. If you're tipping forward and your foot's coming up, okay, and you're feeling the pressure on your toes, you've gone too deep. You need to work on hip and low back range of motion before you continue. As you go down, that weight should stay on the heels. If you're drifting forward like that, you've gone too deep. Straighten back up and put your heels back on the ground, okay? Let's see, another important one is making sure that your knees are not collapsing together. When you go down, if they go like this, that's very, very bad. We don't want that. Always fight for nice straight up and down, like that. Pushing through the heels, okay? Your instructor of whatever class that you're working in, if you guys are doing squats, I'd encourage you, if you have any questions at all, to make sure you're doing a squat safely, work with the instructor. Take the time, develop your squat technique, very important. Questions on squats? Okay, go forth and squat. Lunges. I can't tell you the last time I saw someone in the gym do a lunge the right way. It really bothers me. And it's not their fault. It's the fault of just being modern, modern times. Everybody, all of you, everybody in this room except Jesse and back there is all like this, right? What are our hips doing right now? Our hips are flexed, okay? Jesse back there, she's standing up, so her hips are straight. All right, so as we sit here, and one more gentleman back there has got it, he's standing up. Our hip flexors, okay, which come from our spine and go to our leg, they're shortened right now, right? So when we do a lunge, okay, this back leg is stretching that muscle. Because it's tight in everybody starts to tend to lean forward to relieve the pressure on that hip flexor, right? A proper lunge, you're vertical like this, right? And you'll feel that tension down the front of this leg. So as you do a lunge, if you don't have proper hip flexor mobility, as you lunge, you'll tip forward like this, okay? But you should be back like this. Don't go so deep in the lunge if you feel that tilting forward. It's okay. Stay more superficial. Don't go deep into the lunge if that occurs. You can work on your hip flexibility in order to get a deeper lunge, but don't lunge with poor hip flexibility, as that really excessively loads the low back, the lumbar spine. So that's my biggest tip for lunges. Someone already asked me to demonstrate a glute bridge, so there you go. Calf raises. So there's multiple different positions in which to do calf raises, and like we said earlier, a straight leg encourages the teardrop looking muscles, okay, the gastrocs, and a bent knee works the soleus, or the deeper round muscle of the calf, okay? And if you change your feet position, wherever your toes point is where you preferentially are targeting whatever gastroc, right? Because there's two heads of the gastrocnemius. So if you're pointing out like this and you do a calf raise, that doesn't even feel right. Yeah, that's backwards. I apologize, that's backwards. I should not have put that in there. When you go out, you feel it on the inner. When you go in, you feel it on the outer. So wherever your heels point, we'll go with wherever your heels point. Let that be on the camera. Wherever your heels point, that's where you're going to target the gastroc, okay? And every time you bend your knees, it's going to be soleus. That's without question. And then a hip adduction and abduction superset. So everyone's seen these machines in the gym, right? It's a shame that more men don't do them, right? I think men should do these. Yeah, all right, he does it very good. All right, if you're a man in here and you do it, raise your hand. So like, of the 10 guys in here, 1, 2. All right, women, how many women in here do these? There you go, much more, okay. Everybody should do these, everybody, okay? And what's a superset? So a superset means 2 consecutive exercises with no rest in between, okay? And the reason why this one breaks the rule of the rest between is because there is no cross-play between the 2 muscle groups. So as you're doing the abduction, where you're closing your legs together, there's literally no activation of the inners. Okay, and then as you close your legs, there's literally no activation of the outers, of your glutes, okay? So This is one exception in which even early on in your training, in your strength training, you can do these exercises back-to-back, no rest. But between sets, you still do your rest. So you'll do the abduction where you open the legs, you'll do the adduction where you close your legs, then you'll rest, and then you'll do it again. And you'll do that 4 sets, same thing, 10 to 15, moderate to high intensity, same rules. Okay? So that's what a superset is. Now go, be super. Okay.
What weight do you recommend you start doing?
That is an individual answer for everybody. And when you're starting, I always encourage people to go light and to track the level of exertion you felt on that exercise. So for example, me personally, when I do abduction, adduction supersets, my abduction, I start like 180 pounds, right? And I'll do 15 reps. And then on the next round, I'll go 200, and I'll maybe only do 14. And the next one, 220, and then I go 12. And so it's just whatever works for you. The weight, I want to make a point. The weight is irrelevant. The weight does not matter. What matters is the challenge to you. Your muscle does not know whether it's 50 pounds or 5 pounds. What it knows is the level of exertion. And our bodies respond to moderate to high exertion loads, right? So it's the weight is irrelevant, the numbers are irrelevant. It's useful in predicting what your 1 rep max is, and therefore what target you should be aiming for, right? So that's where the little bit of math comes in. All right, core. So this is not just a six-pack, right? The core is actually a pretty complex piece of anatomy, and it goes from your rib cage all the way down to your pelvis. So from the ribs down to the pelvis, all of the muscles in there can contribute to the core. And the purpose of the core is to transmit forces from the upper body to the ground, okay? And to stabilize the spine and protect the abdominal organs and everything that's contained within the abdomen. So every time we move, every time we take a step, we shift, right? We're carrying our torso with us, right? And as we do that, there's loads placed on the spine, and the core helps distribute that load as well as stabilize the spine. There are many different aspects. Everybody knows these ones, right? Your rectus abdominis, that's your six-pack. Of all of the core muscles, it is the single least important one. I could really care less about your six-pack, all right? Everybody in this room, every single one of you has a six-pack, okay? And now it's under some skin, it's under some fat, but every single one of you, if we strip off enough weight from you, we're gonna see a nice six-pack there. That is not the case with the deepers, right? With the transverse abdominis, the internal and external obliques, the quadratus lumborum, right? Your hip flexors that we were talking about. Those things are trainable, and they tend to atrophy and get weaker if you don't use them, versus the rectus is just always there no matter what. So these are the ones that are more important: the obliques, the transversalis abdominis, the quadratus lumborum, and the erector spinae. Those are the most important core muscles to maintain flexibility, stability, and control of in order to prevent low back injury, in order to prevent hip injury, in order to avoid falls. So yeah, that's my rant on that. All right, so how do we exercise these? The key is, starting is the plank, all right? So I heard a couple moans and groans, okay? Everything is adjustable to your individual needs, okay, and your individual capabilities, right? You can start this somewhere on like this, where you're elevated like this, and you could start here, okay? You don't have to be flat on the ground. You can put your knees down, okay? You can do this up against a wall. I don't care, okay? What I care is that you engage the core, and you have to load. As you can see, she's trying to stabilize the core to not let it move, right? Because there's a load on the upper and lower extremities, and so we're preferentially creating a bridge, and the load here is what we're managing. In order to do that with more than just your six-pack, in your brain, think to myself, push my belly button to my spine. It sounds funny, you're like, I don't have a muscle that goes from my belly button to my spine, but you actually do, and it's the deeper core muscles. It's your obliques, and it's your transversalis, and it's your quadratus lumborum. So as you're in a plank position, think to myself, pull my belly button to my spine. So if everybody does that right now, right, it doesn't feel like a crunch, right? It doesn't feel like that. It's a bit more dispersed. It's a bit tighter of a feeling in the general abdomen, in the general core. So as we go through every single core exercise, that's what I want you to think. Push my belly button to my spine. Yeah, this one makes me groan. So side planks are the same rule though. So belly button to spine. The additional thing you have to think about is don't let the hips fall. And once again, you can do it on an elevated surface like this, right? And this, once again, is engaging your obliques. It's engaging the core. You can adjust it for intensity. And I say hold for time, which I should have said on the last one. You hold for time. The goal is 60 seconds. You might not be able to start there, and that's fine, okay? Do what you can. What you'll find is you start shaking like a leaf, right? You're in there and you feel everything start to do that. When that starts to occur, take a rest, okay? Rest for 60, 90 seconds, come back at it, do your 4 sets. Next core exercise, bird dogs. This is probably the single most important one. If you want to skip planks, I don't recommend it. If you want to skip side planks, I don't recommend it. Don't skip this one. This one has tried and true evidence in the medical literature that this is the single best exercise for core stability, okay? And so it's alternating the leg and arm extension. So you're on hands and knees, and then you reach opposite arm and opposite leg, okay? The key for this is it should be very controlled, okay, and back down. It shouldn't be like that. No. Very slow and controlled, because what's happening is as you're doing this, you're creating a rotational force on the torso that you're needing to stabilize at different loads as you lift the arm and the leg. And you go both sides. If this is too hard, flip on your back. Do it on your back, okay? Do this, okay, on your back. It's fine. So it's the 10 to 15 repetitions because it's a move, right? Versus something static, you hold for time, right? But this is it's a movement, so it's same thing, 10 to 15 reps, and you can put resistance on this too. You can have your 1-2 pound dumbbells, 10, 15 pound dumbbells, I don't care. Put ankle weights on, put a strap in between your legs to get resistance on lifting your leg, right? You can add resistance to these things as you get better. Same rule, twice a week. Same rule. Principles. You got to stick with the principles. Mary.
There's a group of us that exercise together, and we also do this one on the stability ball.
Yes, great.
What's the real difference between with and without that?
Just more advanced. More advanced. You're on a less stable surface, so you're going to get more rotational torque, right? Because you'll fall off center and get back to center, and all those micro motions improve the stability of the core. So all these exercises can be adjusted to the intensity, and if you're able to do this on a balance ball, you're doing pretty good. Probably why your hip don't hurt.
For people with knee problems, can you demonstrate how you do it on your back?
Sure. All right. So like this, right? And then this. Like that, right? And you can put a band between your ankles. You can put weights in your hand, okay? To where you're actually having to stretch and actually push against some resistance. Make sense? Good. Or double up a yoga mat. Double up a yoga mat and kneel on it. It's pretty helpful. Wear knee pads, you know? So whatever you got to do. And then my favorite is twists, and it's my favorite because it's a vanity thing, to be honest with you guys. So twists, belly button to spine, and rhythmically twist. Notice my pelvis is not moving. It's all upper body. It's all upper torso, and it's small. You shouldn't be going way over here or way over here, right? It's small, back and forth like this, head straight, torso, pelvis forward. No movements of the hips, okay? Tight belly button to spine, and rotate like this. Okay. And I do 300, but you can do however many you want. I don't care. What? Yeah, you'll be sore the first couple days. Anyways, yeah, so thanks very much, guys. We've got, 10 minutes for questions. So it's my pumped wife. I just like to show her off. What can I say? These are really hard, man, with the ab wheel. Anyone ever do those? Whew, those are tough. And then, there she is, like, I think 3 days before the birth of our first son. In there squatting. Got to do your squats. So, questions? Question?
Yeah, what's the right blend of aerobics and strength training?
So, what's your goal? Just general fitness, or are you? Sorry, the question was, what's the right blend of aerobic and strength training? So it's what's your goal. If your goal is just general health, you should do aerobic training at least 150 minutes per week, okay? And you can split that up. You can split that up however you want, but as long as you get to 150 minutes per week, that's the recommendation to maintain cardiovascular fitness, all right? Cardio, aerobic function. And then the strength training we just talked about, 2 days a week, 8 to 10 exercises, focusing on large muscle groups at a moderate to high intensity, shooting for, failure between 10 and 15 reps. So it's really not that burdensome when you just plan it out and you structure it and you put some thought into it ahead of time. Question?
I take Eliquis and Plavix.
Okay.
Severe muscle fatigue.
Yeah.
What do you recommend? I bicycle 5 miles a day. I walk the pool 2 hours a day.
Okay.
But, there's times when I hit that wall, I can't move.
Yeah, so I would focus a lot on your nutrition at that point, because if you're hitting muscle fatigue really quickly, that tells me that we're not able to put a bunch of sugar in your muscles for your muscle to use during the exercise.
I'm a diabetic also. I'm a low fat, no salt, low cholesterol.
So I could give you a 4-hour seminar on why the mainstream recommended diet in this country is totally garbage. It's the wrong thing for people. A low-fat diet is not the way. I could really go down a big rabbit hole in this one, right? And we can talk about why diabetes, okay, you should not overdo certain carbohydrates, but there are other carbohydrates that are just fine. Grab a card. You and I will sit down and we'll just hammer this out for you. Yeah. Oh man, I'll tear apart the mainstream nutritional recommendations. They're terrible.
I just had one question, because you were going over the anatomy of the thigh.
Yep.
Where does the IT band?
So the IT band it comes from the wing of the pelvis, okay? And the IT band is a conglomeration of the glute max, which is the big butt muscle, and then a little muscle at the very top of the wing of the pelvis called the tensor fasciae lata, or the TFL, some people call it. Those two, as they go down, they become a tendon, the IT band, and that thick band comes down the leg and inserts into the head of the fibula, which is the skinny bone on the side of the leg right there. So yeah, so the glute max comes from a large area in the butt, comes forward and goes down as the IT band. Then the tensor fasciae lata, which is a small muscle up here, blends in with the glute max as it becomes tendon and goes down the leg. Question? No, but there is a harm if you do too much more than 2 days, right? So be careful not to train the same muscle group on consecutive days, okay? So if you're doing 3 leg days per week, you're kind of flirting with trouble, okay? But if you do 2 leg days per week, you're gonna stay safe as long as you're following the principles of load and repetitions and form and stuff like that. So it is absolutely possible to overdo it. And in the older population, it is easier to overdo it, right? Because we all remember when we were younger, even me myself, I've started to have some injuries and I don't feel invincible anymore. sucks. Yeah, it's you could overdo it even easier than I can overdo it, and I'm already overdoing it. So that's why following these principles is very important. Question, Miss.
Might be for Jesse, but I wondered about sit and be fit, and we do up our weights and for the strength of the rubber bands. Is that better every other day?
Well, I think a group exercise class is slightly different than hitting the gym and going and doing those reps. But Dr. Rogers, in terms of group exercise class, because we're not figuring out that formula,
Yeah.
we're staying with a usually fairly lower weight.
Yeah. So sit and be fit is a fantastic way to get introduced into strength training and to start to mobilize. And I absolutely recommend it when you're trying to pick up your activity levels, trying to get more fit. Eventually, you got to get out of the chair, though. You got to get up. Whether it's if you have hip and knee and ankle or foot problems, and getting into a pool, okay, and getting in a shallow pool and doing your lunges and your squats, you're gonna have to get up out of that chair at some point. The sit and be fit with the resistance bands, you can track that. Different color resistance bands have different resistance, so you can say red, 15 reps, 5 intensity. Maybe next time I need to go to black, right? So maybe I'll do 12 reps, at an 8 intensity, right? So just because you're not using a conventional weight that has a specific number, the bands are rated as well, so it's still trackable.
But is it still okay if let's say your schedule is Monday through Friday, I like to go to sit and fit every day at 10 a.m. We're going to do squats every single day in that class.
Yeah, probably at a rep range that doesn't fall on these, right? Yeah, so and I didn't get into this, but I'll cover it real quick. There's 3 different types of muscle fibers in our body. There's type 1s, which are used for endurance, right? So that's doing like 20, 30, 40 reps. That's going on runs, right? Those muscles, they don't fatigue very fast, but they don't produce a lot of power. They don't produce strength. They're endurance muscle fibers. And then there's type 2 muscle fibers. There's type A's and type B's. Type A's can kind of switch back and forth between endurance type fibers and strength type fibers, and then type 2Bs are purely used for generating power and strength. When you're doing those higher repetitions, 20, 30, 40 repetitions, you're not training your 2As, you're not training your 2Bs, you're training your type 1s, right? So you're not going to get stronger. You'll have more endurance. Your cardiovascular fitness will go up, but you're not generating strength. That's where the lower repetitions at the higher weight are necessary. So you can do sit and be fit on consecutive days and not undergo muscular injury because you're not really challenging the type of muscle fibers that generate force to develop the injury. Does that make sense? Yes, question. Are there what? So this is being recorded, so you can watch it anytime on the YouTube channel. I'd be happy to pass it out, so she can email it out as a PDF file, that's fine. And then I wanted to also point you guys, there's 3 very good resources. This is probably your best single resource. The National Institute of Aging has a ton of really good high-quality YouTube videos. The American College of Sports Medicine has really good recommendations that break down in a pretty good amount of detail everything we talked about. And then Silver Sneakers program is a program offered via Medicare that is a very good exercise resource as well. Mary.
Mind if I talk about how you changed my exercise?
They need the room in just a few.
Yeah, and I have a plastic surgery appointment.
I just want to say
Not for me, though.
I changed my exercise routine, and so now I am too functional for hip surgery.
Yeah, yeah,
So it really does work.
yeah. This stuff works. Otherwise, I wouldn't be wasting your time today because I'm not wasting your time. Yeah. All right, guys. There's some business cards up here if you guys would like some. Thank you very much.